Happy weekend, everybody. Dr. Vasquez here, coming to you live after getting my ass kicked for about the past week with a lot of dust allergies that we had. Our area got hit with a really bad dust storm, and so, yeah, I've been dealing with that daily, nightly, and ever so rightly. So, right now we're going to talk about this article, which I just read over the weekend. And this article comes from a journal called Brain Communications, which is published out of Oxford University. And this is a very, very highly regarded journal. And that doesn't mean anything. So, you know, a so-called highly regarded journal can still publish crap. But the higher tier journals like Lancet, British Medical Journal, Archives of Internal Medicine, JAMA, and New England Journal of Medicine, sometimes they publish stuff that's good and sometimes they publish stuff that's bad, but typically it's in support of the drug paradigm. You're almost never going to see a top-level journal, even a specialty journal like this one, you're almost never going to see them rock the boat. You know, it's always going to be drugs. Sorry, that picture's a little bit crooked. That's better. So, yeah, this is an important study. It's not like, you know, groundbreaking or anything, but it's a good study. But I'm also going to show you the bullshit. So if, you know, depending on where you are in your level of study or clinical knowledge or whatever, you know, I suppose different people would have a different interpretation of this article. I would consider this article to be pretty much within my specialties. Obviously, I've read a lot of research. I know what the terrain looks like. I've studied a lot of brain research, especially with regard to my work in autism, fibromyalgia, migraines, which I have published on in the Sorry, that's the cough I've been dealing with for about the past week from all the sand and dust. In my case, I've published on those topics, all related to brain function and brain inflammation. Again, fibromyalgia, chronic complex regional pain syndrome was in the same article, but I've written on them before and I'm going to write on them again. Migraine headaches and autism. So, you know, I have some ability to interpret this article, not simply read it. You know, at whatever my level is, you can say it's high, you can say it's low. I'm just saying that different levels exist, and I happen to be at a certain level where I can read this article and provide a lot of different levels of interpretation as well. So anyway, my interpretation of an article like this from the start is that this is going to be mostly a study of secondary phenomena. They may claim to have found something unique, but they didn't. What they found here would come as no surprise to anybody who's studied neuroinflammation and, you know, neurotransmitters and immune function and things like that. And I'm just saying that from looking at the title. So I look at the title of an article like this and I say, well, this is exactly what you would expect. These are secondary findings, and they're gonna claim it's a breakthrough because they always do, and then they're gonna claim that the response to this is to use repurposed drugs. That's how the medical bullshit factory works. The answer, they're almost never going to talk bad about a drug. When they find that a drug, here, check this out. And some of you have seen this before, but I'm going to say it because it applies here. When they find that a drug is causing adverse effects, their answer to the problem isn't to stop using the drug, it's to use another drug to cover up the problem. And that's exactly what they did here. So, you know, every once in a while I publish an article or a video under the title of what I call the cult of medicine. And this article falls right into the cult of medicine. nonetheless, I'm not saying it's horrible. It's good research. I'm sure that I will cite this in my next book or my next, big work, which will probably come out next year. It's a worthy study. I'll show you what they found. I'll show you why it's no surprise. Toward the end of the article, they actually provide the appropriate context for their findings, which is basically saying this comes as no surprise because anybody who knows about neuroinflammation would have figured this out. So they do say that towards the end. But I'm going to show you some other things that they say. I'm going to show you some things that they say and some things that they didn't say that they should have said. And anyway, we'll just get through it. I'm still kind of recovering from my own inflammatory event over the last couple of weeks or a couple of days. So anyway, they call this systemic increase in AMPA receptors associated with cognitive impairment of long COVID. If you're a conspiracy theorist, then you already know what's going on here. You already know, and you're going to be right. You already know what's going on here. So conspiracy theorists tend to be ahead of the game, as they have been since the start of the pandemic, and obviously before that. And if you're in the conspiracy camp, then you already know what happened here. So first of all, I provided an editorial correction here. They did not document systemic increases in AMPA receptors. Systemic would mean the entire body. What they found here would be more reasonably described as brain-wide increases in AMPA receptors. They didn't look in the entire body, they only looked in the brain, and that's important. But they shouldn't have called it systemic because they didn't look systemically, they only looked in the brain. So speaking of the conspiracy theory that I just alluded to, you're looking at it right here in my notes. So what they tried to state here is that people with long COVID have brain dysfunction, and that brain dysfunction correlates with inflammatory markers in the blood and altered neurotransmitter status within the brain. Okay, no big surprise. They focused in on a particular type of glutamate receptor. These are metabotropic glutamate receptors. It's not the ionotropic one that I usually talk about. These are metabotropic AMPA receptors, and they are located throughout the body. So they could have legitimately done the research to look at a systemic increase, but they didn't do that. They only looked in the brain. So they should have called it brain-wide increase in AMPA glutaminergic receptors associated with cognitive impairment of long COVID. I suspect this is completely a compensatory mechanism. They're going to treat it as the medical profession always does. They're going to treat this as if it's a primary problem, or maybe they'll spin it eventually into a genetic whatever, like they always try to do. When they don't want to see the truth, they call it genetic. Maybe they'll do that eventually, or maybe it's already being done. I don't know. But the data shows, in my opinion, or at least it suggests a line of thought consistent with, that was well stated, worse brain function with more vaccines, thereby also providing evidence that the vaccine didn't provide any protection against COVID. So what they're trying to say, people get COVID, and then some of them have this long COVID syndrome with long-term chronic inflammation. This is such bullshit. With long-term chronic inflammation that leads to brain dysfunction. These people can't work, they can't contribute to society. Oh, we have such pity for these people. We need to save them. And the way that we need to save them is we need to vaccinate more people. And the people who get long COVID and are disabled because of the brain inflammation, we need to treat them with another drug. So see what they're doing? The evidence that they present here implicates the vaccine. Is their solution to investigate the vaccine? No. Their solution is to repurpose another drug to use on top of the vaccine to try to solve the problems, which in my opinion could easily be attributed to the vaccine. They just didn't want to say it. So like I've said before, in fact, I think I said this in the video that I most recently did. It was either last week or the week before. I think it was last weekend. To get into a top-level journal, and I've had this happen to me, I talked about it last time in the video, to get into a top-level journal, which a researcher or academician may legitimately want to do for important reasons, a lot of times to get into a big journal, you have to buy into the bullshit, and you have to go along with things that you don't even agree with. Like when I got published in JAMA back in 2004, I wanted to get published in JAMA because at that time, that was before I went to medical school, but I was applying for a PhD program. And I thought, well, it'll make my application look better if I get published in JAMA, whatever. So even when the editors totally clusterfucked my article, I went along with it for two reasons. One was to get my name in the journal because that's what I was trying to do. But the other thing is, even if they butcher, in this case, my good article, even if they butcher it, it's still better than nothing. And they weakened it, they watered it down, they made it easy to defeat because they allowed the other authors to present new information that they'd never presented. And they said, well, this is why. It was an osteoporosis study, and they actually caused vitamin D deficiency in these patients with osteoporosis. And I pointed that out. I said, you can't cause vitamin D deficiency or undertreat people with vitamin D deficiency and then say the vitamin D supplement didn't work, because you're contradicting the entire physiology of your proposal here. Well, anyway, that's what they did, and that's what was published, and that's what I was trying to combat, but the journal butchered what I said. And maybe the same thing happened here. I doubt it. Excuse me. But it does happen. So, yeah, they found more glutaminergic neurotransmission in the brain of these people with COVID. Okay, well, anybody at a certain level could have figured that out, but they had to document it. I'm not saying this isn't worthwhile. It's, we can certainly make assumptions. Like I could have assumed that this was happening even without doing the research, but the research still needs to be done and still provides benefit for documenting our assumptions and assertions. So, okay, they did it. I would have guessed this. Remarkable, 100% sensitivity and 91% specificity. I mean, that's almost unheard of. I mean, this is amazing. I mean, this is an important finding. Most of this is propaganda. Actually, the propaganda starts. The propaganda started here, but my article didn't refresh from some comments that I made in this section. So, going back to what I had said before, no one's going to get published in a big, top-tier general medicine journal or specialty journal without kissing vaccine butt. And so that's what they had to do here. So, so they talk about SARS, COVID infection, and how dangerous it is, and how these people go on to have brain fog, and they can't work, and they can't. We have pity for people who can't contribute to society, as long as we have a drug for it. If people are disabled by vaccines and they quote unquote can't contribute to society because they're brain dead or they've got autism or whatever, nobody cares about those people because they're too injured to have an easy solution with drugs. And so what they're trying to do in this article is, here's the drug that they're trying to propose here. Parapampel. So P-E-R, AMPA is the type of receptor. Whatever. It's a stupid strategy. I'm already telling you it's a stupid strategy. So, as I was looking at this article, I noticed, as you can see on the screen here, that they talked about the participants. So they're talking about the participants supposedly after an infection. And we all know that the medical machine has been pushing this COVID vaccine. But they made no mention of the vaccine in their participant outline. And so I was very suspicious of that. So later they talked about it, but look at where they put it. They put it in the statistical analysis. It should have been in the participant description, not in the statistical analysis, right? So I'll magnify this so we can take a better look at it, and then I'll show it to you on another page, which I will also magnify. So let me try to scoot this page over just a little bit. Among the 30 registered patients with long COVID, 36% were unvaccinated or undervaccinated, and 63% were fully vaccinated. Remember now, we're talking about a supposed complication of the COVID infection. Well, if 63% of these patients suffered a long-term complication from the COVID infection, but 63% of them were fully vaccinated, that tells you that the vaccine didn't work to either stop the infection or stop the complications, right? So one of the reasonable conclusions from this article could be the vaccine doesn't do a damn thing. It doesn't stop the infection and it doesn't stop the long-term complications. That would be a minimal reasonable statement to conclude from this one sentence. However, of course they didn't say that, because they wouldn't get published by Oxford, a vaccine factory. They wouldn't get published by a big university married to drug companies. They wouldn't get published by that university if they said anything bad about the vaccines. Again, maybe they know what's going on here and they just weren't allowed to say it, or maybe they're too much in the drug paradigm and they can't say it and they don't even see it. But to me, this is quite obvious. For those of you who don't believe me in what I'm saying, when I say that this is obvious, the obvious conclusion is that the vaccine didn't work. I'll make it even more obvious by going to the first part of this sentence. Among the 30 registered patients with long COVID, watch what they say here. 36%, almost 37%, 36% were unvaccinated or undervaccinated. Well, why not just be clear? Why not just tell the truth? Why not just say these people were unvaccinated, these people were so-called undervaccinated? By the way, undervaccinated never existed in common conversation until the COVID bullshit. So they are participating in the COVID bullshit 5 years later. Among the 30 registered patients, 36% were unvaccinated. So just say they were unvaccinated. No, they had to mix it in with undervaccinated. How many vaccines are required to produce brain damage and chronic neuroinflammation? How about one? So by not separating they have the data. They could have given all of us clear data. They could have said, these people were unvaccinated and they probably had no problem whatsoever. But they didn't want to say that, even though they probably found that. Otherwise, they would have just said it. They counted how many people were unvaccinated, and they counted how many people were undervaccinated, just like they counted how many people were fully vaccinated. And those should be three separate groups. But I suspect that their data showed them that the unvaccinated weren't affected by this. And so that's why they had to mix unvaccinated with undervaccinated to cloud the issue. I'll show you where they present that one more time here on this page. So I'll magnify this a bit more, and then I'll have to adjust the page one way or another. Sorry, let me go back one more. Let's see if I can get this into the screen. Yeah, eventually we'll get there. Oh, I hate those automatic changes. Well, we're still good. All right, so we're going to focus in on, I think, whatever this is, figure 1D. But you'll notice here that their patient population is, remember, we're talking about cognitive impairment, brain inflammation, increased risk for dementia, people who can't work, people who can't function. And so I already showed you what they said in the text, and now we're just looking at the same thing in graphic form. Most of their patients were fully vaccinated and boosted. You'll notice that they say fully vaccinated or boosted. Well, what the hell does that mean? Why separate those things? According to their terminology, fully vaccinated is boosted. But look at how they cloud the issue here. Unvaccinated or undervaccinated. It's because they probably didn't have, I'll go back and look at the other data if it's available. Sometimes they put stuff online because they're trying to hide it. But again, I suspect that all of these people with this brain inflammation, cognitive impairment, that's being attributed to long COVID, I suspect that all of them were vaccinated. And the reason I have the right to believe that, outside of any conspiracy theory or I'm a right-winger or I'm a left-winger or whatever the hell anybody wants to say, the reason I have justification in believing that is because of the lack of clarity here. They had every possibility, and indeed they had the obligation to be clear. They chose to not be clear for a reason. My conclusion is, based on the suggestions here, my reasonable conclusion is that these are vaccine effects. Their patient population with this brain inflammation, cognitive impairment, is disproportionately represented by people who are so-called either fully vaccinated or fully vaccinated and then boosted. It's just the same thing. It's a stupid way to... See, both of these are stupid terminologies, right? Unvaccinated does not equate to undervaccinated. So they should not have included those things together. Their second descriptor, fully vaccinated or boosted, I mean, that's just stupid. If someone gets a vaccine, they are vaccinated. If they get multiple boosters after that, they're vaccinated and then boosted. But you see how they're trying to... With the COVID pandemic, what we saw was the introduction of new vocabulary. Because what they want you to think now is that, oh, well, you only got one vaccine, you're not fully vaccinated. In order to be fully vaccinated, you have to have at least 2 or 3. Well, in the old days, those were called boosters. So what they want you to do now is get vaccinated, but to be fully vaccinated, you need 2 more. And then they want you to get boosted on top of that, which now you're into 4, 5, and 6. My God. According to this data, you could be fully vaccinated and boosted up to 4, 5, 6 vaccines, and it still doesn't protect from COVID, and it still doesn't protect from this complication. So, yeah, I think it's disgusting. Let me move the page over, and I'll show you the part toward the end. So that's what they found. Increase in brain AMPA receptor density in patients with long COVID, showing that the increased, sorry, I'm going to try to move the screen a bit, showing that the increased AMPA receptor density was associated with cognitive impairment and blood markers of inflammation. Great. Is that important? Yes. Could we have guessed that that was true? Yes. Do we understand exactly why this is happening? Pretty damn much. And they finally state it toward the end. See, remember what I said earlier? I'm just trying to show you the proof of what I said. See? So you don't just think it's my ego or my opinion. I looked at this article and immediately I knew that these are secondary phenomena. The AMPA receptors are upregulated to help the body deal with excess glutamate. I mean, it would be obvious to anybody who has studied this topic. The AMPA receptors are upregulated to help the brain, to help the neurons deal with the excess glutamatergic load, which is exactly what you would expect. And down here somewhere, this is almost the last page, or no? It's almost the end. Maybe this is where they say it. Yeah, here they say it. Compensatory mechanisms for unknown loss of brain function. It's compensatory, but that's not the right reason. But here's the right reason. Recent studies have shown that tumor necrosis factor alpha released from astrocytes has been reported. They don't need to say recent studies and then have been reported. One kind of implies the other, but anyway, that's what they did. Recent studies have shown that tumor necrosis factor alpha released from astrocytes has been reported to promote the trafficking of AMPA receptors to the neuronal cell surface, thereby enhancing excitatory synaptic transmission. In line with this mechanism, we observed a significant positive correlation between plasma tumor necrosis factor alpha levels and the index of AMPA receptor density in the current study. Well, yeah, no surprise. Yeah, and so all the way to the end, so in their conclusion, and we are in the conclusion section, or discussion, whatever they call it, discussion. In this discussion session, they should have said something. You see how they tried to bury it? They should have said something here about, oh yeah, and most of our patients were fully vaccinated and boosted. They can't even admit, it's not even that they can't simply admit what they should have said, but they didn't even present the data. They should have clarified 3 different groups: unvaccinated, completely unvaccinated, 1 or more vaccines, and then multiple vaccines with multiple boosters. Those are the 3 groups. They had the data, they hid the data, they didn't want to talk about the data because the data shows in their own table right here that most of their patients were fully vaccinated and fully boosted, which shows you the vaccine did not protect from the infection and it did not protect from the long-term complications. So again, as I said at the start of this video, that's the cult of medicine. That's the cult of medicine. The cult of medicine is never talk about adverse effects from vaccines, especially, and then propose a solution that involves using another drug to cover the problems caused by the vaccine. And that's what I would expect that they say down here. I already showed it to you once before. But yeah, they're proposing the repurposing of a drug that no one uses because the drug's already available. I presume it already has approval. And so yeah, just like they did with molnupiravir, let's take a worthless drug that no one's using and then try to repurpose it for something that now we're going to say is caused by under-vaccination with the COVID vaccine. So by doing so, we're encouraging more people to use the COVID vaccine, which, according to their own data, is the probable, is either the problem. So we could separate this in a couple different ways, all of which would be reasonable. But on the one hand, the most extreme would be, and I'm not saying I agree with this, but the most extreme thing a person could say is that the vaccine is causing long COVID. A person could say that. I would say, the intermediate level, that the vaccine sure as hell didn't protect these people and quite likely contributed to the ongoing neuroinflammation that they're having. The most conservative and completely unreasonable thing to say would be to say that vaccine status has no relevance here at all. Because it obviously does. I mean, most of these people were vaccinated, multiple boosters, and they still got the problem. So the vaccine didn't work and it didn't protect them. So that's my interpretation of this article. I will provide the article on the website, and hope you're all doing well, and I'll get some more videos to you as soon as I can. Hope you're all doing well. Take care.